So what is the best thing that somebody could do if they realize that their neuroses is getting in the way, or that they realize that it's coming up and it's creating a
Well,
barrier?
first thing, you have to find help, but you need to know that you're having neuroses that is getting the best of you. You need to have that, let's say, we can call it self-consciousness, right, of what's going on in your own case, or if something's not right about your state, your body, your mind, your feelings are not right. So you need to talk to somebody about it. That's probably first, I guess you might say, level of self, help. I talk to somebody. And hopefully you find someone who can help you to objectively understand what you're going through, so that you don't feel you're the only one going through such a, whatever it is, time, such a time karma. But most karma is time-centered, time-governed. So there's a time for it to come, there's a time for the pain to go. Okay? The time for things to come, time for things to go. Time for people to come in, and then time for people to go as well. So everything is appearing and disappearing in its own time. So I think that's a safe understanding to begin with. If you're troubled by what you see in your own case, you say, well, it's coming, everything is coming and changing already and disappearing. So if that implies that there are some things that come you want to enjoy more because they're going to go. I don't mean kill yourself because of it, but yeah, it's all passing. This whole thing is passing. Your life is passing, and you're going to pass over. You're going to pass into and pass through and pass beyond this thing called your life, your self-life right now. It's good to keep that in your mind, see, or in your heart, see. Anything else?
Well, the other question that was coming up was the difference between the therapy aspect and the spiritual aspect and the spiritual practice. So when does one need therapy and when?
Well, let me put it differently.
Yeah, sure.
Therapy is like for everybody. Anybody and everybody can use therapy if they need it. Spirituality is a whole other dimension of practice. It's called spirituality, but it's not common. Okay. So real spirituality, and you find that out once you have been through a number of different processes that are part of the, let's say, enlightenment system or experience. You start to realize that spirituality is very difficult. Very few can handle it. It's not like joining your neighbor's church. That's not spirituality. It's not about having, Jesus as your best friend. That's not necessarily spirituality. Putting it on any guru is not spirituality, necessarily. Okay. Could be, related to it remotely, but it's not spirituality. So spirituality has a little bit more to do with transcendence than convenience. Convenience shows up as, come to our meeting and feel good about yourself. That's convenience. That's group work in a positive sense. That is convenience and maybe confidence building, that you have people who care for you. That's not spirituality per se. That's not transcendence, that's social comfort. And religion is supposed to provide you with a little bit of social comfort in the name of spirituality, but you're not floating off the planet, right? You're not going anywhere, and you're not having a certain level of mystical experiences that we would call of the spiritual nature as such. So we're talking about spiritual is hard work, self-transcending, spiritual practice, whereas ordinary, religious karma and situations more social, and at best when it's benign and compassionate, and in your service, wanting to protect you, help you, comfort you, and so on and so forth. Right? Make you feel like you're okay, and you have society, and you have friends and connections, so to speak. So it's for beginners. So it's for the children who are getting on the path, not actually on the path. They're in pursuit of the path. They're aspiring towards the path. So going to Sunday meetings and everything that I did as a child. You go to church and do these things, meet with the people and talk to the elders. All of this is like grade 1. Counseling. Spiritual practice is the unpeeling, the burning away of all your suffering. Two different things. Therapy, people support you in your suffering. There's no peeling away of anything. They give you medications so that you distance yourself from such pain or sensitivity. But it's to mask it for the most part, which helps you to endure your problems, your burdens, right? So they fix you up with medicine, right? But that's not a remedy for it, really. Just covers it up. Often in therapy, they don't really know what's going on, but they have a lot of theories, Freudian theories, Jungian theories, which are complementary to Freudian theories, and other kinds of theories, and New Age theories that are useful. Psychological and super psychological sort of therapies now, bordering on the spiritual, and incorporating, that is, some of the techniques that are typical of the meditation societies or practices, say, for calming and settling you down and bringing you to breathing. And so that's later on. That's not quite like what you're depending upon therapy for. See? So this is more like self-realization practice, and that's harder to do and come by, because it's really about you and not about others. Although ultimately, whatever you do for you is obviously going to be affecting others, no doubt. See? So self-realization practice is being able to be alone. See? Ordinary therapy is to help you adapt more to group in a positive way. You feel comfortable around other people, maybe gain your confidence, get rid of your fears and neuroses. So drop some of that along the way when you're in the right situation where you feel fearless, you feel protected, feel okay. See, so it's evolutionary stuff. Beginning, therapy. Later on, when you're ready, and you walk alone, walk the mountain, go to the top. See, commune with your God on its terms, not your terms. See.